Hello everyone. So after the higher mental function and cranial nerve examination, we have to perform the motor system examination. So I'm going to tell you the details of motor system today in this video. After the cranial nerve examination, we have to perform the motor system examination in which we have to first see the posture of the baby, then assessment of the tone and muscle power. Then we have to observe the spontaneous movements of the body. Then we have to elicit the deep tendon and superficial reflexes. So in posture, we have to see the baby is having the normal body posture or having any abnormal posture. So example in full term baby is having the both arms and legs flexed. In preterm baby, it's depend on the maturity of the baby, and about the posture, I have already uploaded one of my video. So you can see how the baby mature and the posture changes with the maturity. In opisthotonous posture, head and body is arched back. It is abnormal posture seen in the CNS condition and when baby is having the hypertonia. Asymmetry in the limb position can be there whenever there is a fracture of clavicle, humerus, brachial plexus injury, which is very common in the newborn baby. It is a birth injury occur and it is commonly associated with the breech delivery. Whenever there is a full extension of the legs, it may be because of the hypertonia, increased muscle tone. If baby is having the frog-like appearance in the supine position, that means possibility of the hypotonia, decreased muscle tone can be there. Then we have to assess the tone. Active tone and passive tone both should be assessed. For the assessment of tone, in active tone, axial tone assessment should be done, and in passive tone, limb tone assessment should be done. Maturation of active tone occur in cephalocaudal direction from birth to 12 months. Example, head control comes first at 3 months, then baby learns sitting with support at 5 months, then baby learns sitting without support at 8 months, then standing at 9 to 10 months, and after that walking start at around 12 to 15 months. So, maturation of active tone in cephalocaudal direction. While the maturation of passive tone occur in codocephalic direction, toe to head direction. Its maturation start at 28 weeks of gestation age and fully mature in 40 weeks of gestation age. Basically, it corresponds to the myelination of motor pathway. So in the limb tone, limb extensions occur first, then flexor tone occur, and first occur in the lower limb, then in the upper limb. So in the full term baby, you will find that baby is able to maintain the flex posture of all four limbs. While in the preterm baby, it will be depend on the maturity of the baby. For the active tone assessment, we have to observe the resting posture, spontaneous movements, and also we have to observe the movements in response to given stimulus. Then for active axial tone assessment, we have to perform the horizontal suspension, vertical suspension, and pull to sit test. In horizontal suspension, we have to suspend the neonate in the prone position and we have to observe the limbs and head position in relation to trunk. Normally, in the full-term baby, back will remain straight, head is in the midline and limbs are flexed. In vertical suspension, we have to hold the neonate in upright position by keeping our hand under the neonate's arm around the chest. And normally in the term baby, baby will maintain the head in the midline for a short period of time and we will not have the feeling that baby is sleeping through our hands if baby is having the normal tone. While in the hypotonia, sleep feeling can be there and we cannot be able to hold the baby for a long time. In pull to sit test, we have to gently pull the neonate toward the sitting position by holding the wrist. And in term neonate, neonate will be able to lift the head slightly for a fraction of second and able to maintain the head in the midline. Here in this image you can see all three methods to assess the active axial tone. So horizontal suspension, vertical suspension and pull to sit test. Then we have to assess the passive tone by the Emil-Thiessen method. In this we have to measure the angles and we have to perform the sum test. Details of this method I have already covered in the one of my video in the CNS examination video series in tone assessment. So in this we have to assess the angle at hip, adductor angle, at knee, popliteal angle, at ankle, dorsiflexion angle, scarf sign, arm traction and leg traction. Basically passive tone indicate the extensibility of a muscle. In adductor angle, we have to keep our thumb and the finger over the thigh and we have to abduct both the legs. Here in this image you can see when you feel the resistance, then you have to measure the angle between both the leg here. And this angle is normally 40 to 80 degree in newborn baby. After that we have to measure the popliteal angle. In this image you can see you have to flex the thigh and you have to hold the knee with your one hand and with single finger over the heel you have to extend the knee joint, and when you will feel the resistance then you have to measure the angle over the knee area, this angle. And in term baby this angle is 90 degree and in preterm baby this angle is 150 degree if gestation age is 28 weeks. So as the prematurity is more, this angle is more, and as the baby become mature, then angle will decrease. Details of popliteal angle I have already explained in one of my video on gestational age assessment. Now in this video you can see how to measure the popliteal angle. Now the dorsiflexion angle, here in this image you can see we have to gently flex the foot towards the leg and we have to measure the angle whenever we feel the resistance between the dorsum of foot and the anterior aspect of the leg, and normally this angle is 60 to 70 degree in the newborn baby. Now a scarf sign. In this image you can see we have to gently pull the neonate's arm across the chest. When resistance is made, then we have to see the position of elbow in relation to the body. In full-term baby you will not be able to cross even the midline, while in the extremely premature baby even the elbow crossing the opposite side of axillary line. Now in this video you can see how to perform the scarf sign. Then see the position of elbow in relation to the body landmark. Then we have to perform the arm traction. Here in this image you can see we have to hold the neonate wrist and gently we have to pull the arm to the vertical position, and we have to assess the resistance also and see the elbow flexion when the shoulder lift off the surface. Now the leg traction, in this image you can see we have to hold the ankle of the neonate and gently we have to raise the leg into the vertical position. And in this also we have to assess the resistance and knee flexion occur as the buttocks elevate off the surface. So by all these methods, all the angles and the signs and traction, we are assessing the passive tone of the newborn baby. This is the Emil-Thiessen method. Here in this image you can see these are the three angles we have to measure for the passive limb tone assessment: adductor angle, popliteal angle and dorsiflexion angle. Here in this image you can see we have to perform the scarf sign, arm traction and leg traction for the passive limb tone assessment. Now we have to assess the muscle power. In this both active muscle power and resistance against the passive movement should be assessed. Now we have to assess the active muscle power. When we are performing the passive movement, baby will interfere that movements by doing the active movements of the limbs. So we can assess the active muscle power. Now the resistance against passive movement, we have to move the all four limbs in the full range of movements, and we have to see the resistance which is feel during the passive movements of the all four limbs. There are grading from minus to plus 4 for the passive movements. So when there is a no resistance, we feel complete lack of resistance is there. We label as a floppy baby minus 1 grading. When hardly mild resistance, then plus 1. When moderate resistance, then plus 2. Strong resistance you feel plus 3. Then extremely strong resistance you are not able to move the limbs even slightly, then plus 4. Minus 1 and plus 1 grading for the resistance against the passive movement because of hypotonia. Plus 2 is normal, and plus 3 and plus 4 because of the hypotonia. You are not able to move the limbs of the baby and you are feeling the strong resistance because of hypotonia. Here in this video you can see for the passive muscle power assessment we have to move the both the limbs simultaneously and we have to see the power of the muscles. Now for the active muscle power, we have to give the grading from minus 1 to plus 3 when no active movements, when you are doing the passive movements of limb and baby is not doing any active movement, then minus. When active movements present but not able to withhold the resistance, then plus 1. When baby is doing active movements and able to withstand the moderate resistance, then plus 2. When powerful movements are there and difficult to restrain is plus 3. Here in this video you can see how to assess the active muscle power. Active movement of the baby basically interfere the passive movement. We have to assess that. Then we have to observe the spontaneous movements. So intensity of the movements we have to grade. If totally absent, minus. Weak, plus 1. Strongly present, plus 2. Very strong spontaneous movements are present, then plus 3. Then we have to perform the deep tendon reflex and it is graded as from minus 1 to plus 4. When there is a no response, absent response, then minus. When response is decreased, hardly visible, then plus 1. When there is a brisk response, good contraction is there, plus 2, which is normal. DTR response. When very brisk response is there, it is plus 3. When exaggerated or clonus is there, then plus 4 we label. So in the deep tendon reflex, we have to perform the bicep, knee, cross adductor reflex, ankle reflex. So in the bicep reflex, we have to, here in this image you can see, we have to hold the neonate's arm in flexion and examiner place their thumb on the neonate's tendon in the anterocubital fossa and then you have to strike your thumb and see the response. Root value for the bicep is C5 to C6. Here in this video you can see for the tricep reflex we have to keep the arm in semi-flexed position and we have to strike the tricep tendon just above the elbow. And in response to this, extension of the elbow occur. Root value for tricep is C7, C8. Then we have to perform the knee reflex. Here examiner strike the patellar tendon while supporting the neonate's knee in the flex position and nerve root value for the knee reflex is L4. Then for the crossed adductor reflex, examiner strike the finger which is positioned over the medial aspect of neonate's knee. And root value for cross adductor reflex is L3, L4. Then lastly we have to perform the ankle reflex. Here examiner strike their finger which is positioned over the plantar aspect of neonate's partially dorsiflex foot. And root value for this is L2, L4. Then we have to perform the superficial reflex in which glabellar tap, corneal reflex, cuff reflex, gag reflex at the time of suction we can assess. See in this video how to perform the glabellar tape. See in this video how to perform the corneal blink reflex. Here in this video you can see when we are suctioning the oral cavity and baby will have the gag reflex. Here in this video you can see how to perform the plantar reflex. In newborn baby, extension and fanning of toes normally present. So this is all about the motor system examination in the newborn baby. Thank you so much.